My name is Eric Okoth, a physiotherapist by profession, partnering with the Ponea Health. So today we learn to discuss the activities that take place during a physiotherapy session from the point patient enters the clinic to the point the patient now leaves. Or when the patient's problem is as a result of the joint itself. Is it stiff? Then what is causing the stiffness? Is the patient involved in the contact sports or something like that? Or what could have been the problem? So in that assessment, basically the physiotherapist will have to find out what the patient is suffering from or what is causing the patient's suffering, so that when he'll now or she'll now be starting treating, the treatment will be directed to what exactly is causing the patient's problems. That is now number 2. So number 3, we are now going to the treatment. The physiotherapist has clerked, the physiotherapist has assessed and has ruled out or find out what the problem is. So there, the third stage, the physiotherapist is now treating what he or she has found out to be the problem causing the pain or limiting the mobility of the patient. There are a wide range of modalities that the physiotherapist will now use on the patient, depending on what he or she have found out on the patient. So first, if the patient is experiencing pain, so there are a wide range of modalities, as I have said, that the physiotherapist will use. We have ultrasound therapy, which will help to do or to limit the pain. We also have when the physiotherapist feel like he needs to stimulate the muscles, or there's a nerve involvement, or depending on the presentation. So we have a TENS machine, which will help in stimulating the muscles and also stimulating the nerves. Depending also on what stage or what time the patient has reported, we may sort to use a cold therapy or a heat therapy, where the patient may use the physiotherapist may use an ice pack or a hot pack, depending on what the physiotherapist has found out. And again, after that, we also do series of exercises. You do an exercises that is geared towards improving the patient's problem. After that, once the patient has, the physiotherapist has now finished the treatment session, which may last for a period that the physiotherapist has designed. So we go to the 4th stage, where now you reevaluate. You try to find out after the treatment session, how is the patient feeling? So there you try again to reassess what you did to find out what the problem is. Now to reassess, is the pain reduced? Is there improvement within that period of time? Have you improved on the range of motion? Or what have you achieved within that first physiotherapy session? So it is what you have achieved after the treatment, what is now going to determine when do you need to see the patient next, or after how long will the patient is likely to recover from the problem, or how many number of sessions do you think you need for the patient to recover, or whether you may need the patient to be referred for further tests or for further treatments. When we say the kind of treatment machines or modalities that a physiotherapist may need in a given or a specific case, we have a wide range of treatment modules or treatment modalities, depending on what the patient is presenting with. I'll take a case of a patient, maybe when the patient is having a pain. So we have to do a modality that is going to minimize the pains. As I've said, there we may use a therapeutic ultrasound. We may use a TENS machine in that case. Or when the physiotherapist wants now to relax the muscles or improve the circulation of the blood, which will also help in healing, we may go to the hot packs. We have a hydrocollator, which you'll get the hot packs from there, which will help the physiotherapist achieve what you want. So we have unlimited number of modalities or treatments that the list is so long that a physiotherapist may use to treat. So what will make a physiotherapist, or what will suggest on the number of and modalities to use, basically will now depend on what the patient is presenting with. Thank you so much for joining us in this discussion. We are looking forward to engaging you and interacting you a lot in our future episodes. And you can book my services at poneahealth.com.